Joining us via Skype from Kano is Dr. Usman Bashir, our public health physician. Good morning. Thank you for joining us on TVC Breakfast.
Thank you for having me.
Now, the concern by the Presidential Task Force on COVID-19 has been that a lot of Nigerians are not taking responsibility in terms of perhaps obeying or adhering to the safety protocols put in place by the government. How much of a concern is this for you, seeing that there are predictions, if I may use that word, that we might be facing a second wave with the recent numbers we are seeing?
Yes, thank you very much for having me. And like you rightly mentioned, we have thrown all measures, most of the measures we have put in place have been thrown to the bin, meaning that people have what we call low risk perception, meaning that they feel I will not get it, or even if I get it, I will not get the severe form of it. So, and the fear we're having is that the vulnerable group, because there are some people that when, especially those above 50 years old, those who have other concurrent disease, that when they get this disease, they will have the severe form of the disease, and then which can cause a lot of problems. And the reason why we're seeing low numbers in terms of death and complications or symptoms is because we have a large pool of young people. And also, we don't know what will happen because we are still studying the disease. We don't know the weather because now the rainy season is weighing down and then the dry weather is coming up. And this is a time that flu, most of our respiratory tract infections are very active. So we don't know how it will be. And then with the recent finding that the virus can stay on surfaces for 28 days as opposed to the earlier 10 days or 4 days in surfaces. So this portends more danger to us. This is a wake-up call for us to make sure that we put on all our infection prevention measures. Okay. We need to institute them. We need to make sure that they are being obeyed. Because if the second wave comes, there's likely of another lockdown, which will have an economic consequence to all of us. So I think it's very important for all of us to adhere to our social distancing, to wear a face mask when we're in public places, to wash our hands regularly in public places or in other places we're in, and then to make sure that those that come with symptoms, and then we need to up our testing capacity. Yeah. Because the low numbers we're seeing is likely that we're not testing enough. We're not testing enough because we feel, and then it's not only that we're not testing, it's a two-way track.
Dr. Usman, talking about testing capacity now, in all of this now, we do not have enough testing kits in the country. Now, first of all, how do we ensure that while we do not have enough testing kits, we also attract people to come for testing? And how can the government ensure that people get tested regularly for COVID-19 so we can flatten the curve?
Like you said, you know, this pandemic, it's a worldwide event. So even those that are manufacturing test kits, they need it. So there is a high demand, no supply. So for countries like us that we don't have an homegrown mechanism or systems or industries that produces this test kit, there's likelihood of this kind of scarcity. And then despite that, we're not testing enough. So we need to do more. Not only the federal government, also the states. There's need for better coordination between the states and the federal government so that they will know who is doing what, who is going to do what, and then in the long run, the supply chain will not be disrupted so that at least we know federal government might give a waiver or some of incentives that will make the states buy the test kits so that the state will have a homegrown testing capacity. Even though recently I heard that there are some rapid tests that are being developed which are cheap.
Yes.
And then
because
it's also a major, because I think it costs almost $100. That's around 40,000.
Now, looking at the safety protocols that were employed during the COVID-19 pandemic early in the year, will you say that the protocols were effective? And of course, if that is the case, will it be effective again for a second wave?
Like rightly currently we are going down, and then not only that, the people have what we call low perception. Generally, we're feeling that we're not going to have a severe form of the disease. Even if it's going to be severe, I don't even have it. So that it's a major snag in the response, which means people will not adhere to the infection prevention measures. People will not wear their face masks in public places. They will not wash their hands. And they are not observing social distance. And even when they wear face masks in public, it's being taunted. So it's very important we understand that COVID is still with us, and the low numbers we are seeing is because we are not testing enough. We test not enough because people are not coming
All right,
tested.
beyond we not testing enough, do you think that our communication strategy about this virus, how deadly it is, might just be a challenge such that a lot of persons are not understanding the import and why they need to use and observe the safety protocols?
I think it's the attitude because there's enough information being passed. But I think maybe the strategy being employed to pass the message across is faulty or there's some misconception. And also, I think we need to look at those stakeholders, that is the community influencers, the religious leaders. We need to, even though they are carried along, but we need to do more. We need to develop better risk communication strategies that can pass the message and then for people to change their attitude. It's not only passing the message, we need to adhere, we need to change our attitude and perception to the disease. And the only way that can be done is for government to put on measures. But even though we don't want, because we don't want to go back into the lockdown, because it has had a lot of economic consequences. So there's need for people to understand that we need to take responsibility. We need to take this fight. We need to complete this fight. It's like a race. When you're almost to the finish line, you slow down
All right.
because you feel your own race. So it's likely that somebody can come and take over, and then that could be, it has their consequences. So we need to do more.
All right, Dr. Usman Bashir, thank you for your time on the program.
Thank you for having me.